What's going on, everyone? Happy Saturday. Hopefully everyone is doing well, staying safe, healthy. If you had to take a COVID test, hopefully you have tested negative. If you did test positive for COVID, flu, or any other virus, I hope you have a full and speedy recovery with no long-term and no long COVID issues. It is time now for the Saturday edition of the Virus Update for Saturday, January 18th, 2025. If you're new to my channel, welcome to my channel. This is where I do the daily virus update on all those viruses that can make you sick. Let's face it, there's a lot of viruses out there, and things are constantly changing with these viruses. Seems like every day we learn something new. There's always news. Today is no exception. We have a ton of news stories to talk about today, and there's a lot of little things that I want to talk about today. Some things that we don't normally talk about, but need to be mentioned because in the upcoming week there's some things that are going to happen that you really do need to pay attention to. So, want to stay informed with what's going on with COVID, flu, influenza, RSV, bird flu. Yes, bird flu's been making headlines lately. Subscribe down below. Let's try and get my channel to 10,000 subscribers this year. If we do that, that's telling me I'm doing something right and that I am informing people. I want to inform as many people as possible. Hit that like button if you like this video. Hit that notification bell. And of course, leave your comments down below and share this video with anyone you know. So, alrighty. We do have, as noted, several news stories today. There is some data we're going to take a look at. Not going to do much with wastewater today. Tomorrow, if we can get a break from all this news. There's been a lot of news lately. If we can get a break tomorrow's video will feature at least 5 to maybe 10 minutes of wastewater. We'll just have to see what happens. And we're also going to take a look at some numbers from CJS today. He did provide us some data with some states that are just surprisingly really bad when it comes to COVID. I'm raising my hand. My state's one of them. I just can't believe how bad it is. Wait till you see those numbers. First off, quick update on my post-COVID recovery. And for the most part, remember the shaking business? It's not as bad. It's gotten better. It happens from time to time, but it's gotten better. The one lingering thing that I'm still noticing, well, we'll actually say two lingering things. Number one, headaches are still coming and going. And number two, because of when I was sick with the sleeping, the nonsense, my sleep schedule is just all messed up. You may have taken notes last night that I was posting on X really late, and I was posting over on my website, datareport.info, really late last night. That's because my sleeping schedule is now all completely messed up. I really do hope to get that back in order because this upcoming week, I do plan to slowly get back to work. I'm taking everything baby steps because that is what you need to do. If you have had COVID and you're in a post-COVID phase, do not rush back into things. I get it. If you have to go bayer to work, maybe you have an employer. Yes, I get it. But rest as much as possible. And that's what I have been doing. And now I'm going to slowly start easing back into things in this upcoming week. All right, let's get moving. We have a ton of news to talk about today. Avian influenza outbreak in Georgia halts sale of poultry, forces quarantine. This is not good. And I did a little digging, and it turns out that Georgia has a really big production of eggs and poultry products. So this is relatively concerning that they are stopping this, and it very well could help drive up prices of certain products like meat and eggs and maybe some other products as well at the grocery store. So this is something we are obviously going to have to keep an eye on. And you can see here, chicken production 2022, and Georgia's at the top of this list. So that's something that is concerning. All right, I thought this was interesting. This was sent to me yesterday, and, I've thought about this before, and there's a garden program I watch on a local PBS station here once in a while, and someone brought up a question about feeding birds, and he actually mentioned maybe not such a good idea to put certain bird feeders out because it can cause large congregations of birds and maybe squirrels and other animals to congregate together. Well, think of it this way. This is what's going through my mind. With these viruses in full swing right now, think of your child when they go to school. They eat lunch in the cafeteria, everyone congregating together, opening and closing their mouth, chewing on lunch, whatever, talking. A lot of people congregate together. It can spread the viruses, right? Well, with bird flu, it is similar. You get a large congregation of birds, maybe it be the bird bath or the bird feeders if you have several feeders out. All those birds are getting close together, and with that, that could cause more spread of bird flu. So just something to think about. Maybe you're a person that puts out food for the birds in the wintertime because maybe there's snow on the ground. Think about that when you're doing it. I get it. They need to eat too, but it could increase the spread of bird flu in birds. All right, in New York State, we do have a problem. Respiratory illness strain. Rochester hospitals leading to overcapacity. Yes, it looks like there are problems in Rochester, New York, where respiratory illnesses are causing a significant concerns for local hospitals. I saw another article which was similar to this. It said some hospitals at 150% of capacity. Yeah, that is really bad. In fact, it does show that in this article. Last week in Rochester Regional Health reached a capacity of 1,500, while URMC was also over capacity, reaching more than 1,100 patients. But hey, remember, some people said the viruses are no big deal this year. They were referring to COVID, but my point is the combination of the viruses is leading to equally as bad of a strain on hospitals, and we are starting to see some some news stories saying that hospitals in some areas are actually seeing more flu than they did last year, or more strain than they did last year. And that may not be ending anytime soon. I'll show you more why later on when we get to, after we do the air quality check. There's something else that could be a problem going forward in this upcoming week, at least for emergency departments and urgent care as well. 1 in 4 U.S. healthcare workers report mental distress during COVID. Surveys suggest, well, we just talked about overcrowding hospitals. That can be a very stressful situation where, you have a full hospital, emergency department's full, and then you got an ambulance pulling up with someone who just had cardiac arrest, stroke, or something else. I mean, it's enough to drive you crazy. And this was a problem before COVID pandemic, and then COVID came around, which is extra strain on the hospitals, and now it just takes everything to a whole new level. Then there's the concern for a lot of people, I mean, in the COVID cautious community that work in healthcare or work in hospitals, they got to go to work every day and wonder, is today going to be the day that I get exposed? Is today going to be the day that my mask fails and I end up catching COVID in the hospitals? Yeah, that is a real problem. You can read this full study if you want to. I'm going to be posting it on my site. There'll be a whole post today with all the links to all the news stories that we use today. Again, if we sat here and read every individual story, article, study in its entirety while recording these videos, my videos would be well over an hour long. Can't do that. NFL reporter criticized for still wearing a mask in 2025. This is ridiculous. We're not even going to go through the comments. I just have one thing to say about this. The person here is Erin Andrews. They have a picture from 2021. She works for ESPN. I just have one thing to say. If you're out in the public, and maybe you're someone that does not mask, and you see someone masking, respect that person's decision to mask. That is their business. If they want to mask, that is totally on them. If you don't want to, and maybe you don't want to take any advice I give, you don't want to follow anything I say, that's on you. But if someone out there wants to stay cautious during this time where viruses are through the roof, please respect that wishes. You don't know what that person's health condition is. Maybe their immune system is defunct. Maybe they have cancer. Maybe they have COPD, asthma, or something else where if they catch a virus, they're in deep trouble. Okay? Respect the person's wish to mask. And again, you'll be able to read this. There's some real dandy comments in there. We're not going to do that here. All right, Savannah Guthrie had to leave the Today Show for just one day because I guess you only need one day to recover from norovirus. Yep, she had norovirus, and apparently it went straight through her house, but it went really quick. In one day, she was better. I've never heard of someone getting better from norovirus in one day. I suppose it can happen. Then again, I don't know a lot of people who have had norovirus, but for her, it only lasted just one day. All right, moving on to the state of Maine, we do have a couple school closings now. In Calais, Maine, The school department was canceled Friday due to what school officials said was a significant amount of illness. COVID-19, influenza, RSV, yet again, Norovirus, all were issues in that school. And it says earlier this week, the Maine Centers for Disease Control and Prevention reported that 60 people in Maine had been hospitalized in the last week for flu, bringing that total to 165 for the season. So, yep, the viruses are running rampant in Maine as well. Hinsdale Elementary School, hope I'm saying that correctly, had to cancel classes because so many teachers and students are out sick. So, yep, this is a real problem, and this one is in New Hampshire. So, yep, New England, no stranger to the viruses as well. Everywhere you look right now, the viruses are running high, and there are definitely outbreaks ongoing. And again, as stated in a couple minutes, I'll show you a reason why there may be a continuation of that. Houston Health Department confirms a measles case linked to travel. So if you live in Houston, you may want to check this out. I will post this on the website. Minnesota records 50th flu death as massive spike crowds hospital. Yeah, that's not good. 50 flu deaths already in Minnesota. Something to be concerned about. Something else that is not good. A couple notes here that I have posted on the website. Scorpions have had to postpone their 2025 Las Vegas residency. And this is not just, we're postponing it a couple days. No, they're postponing it from February all the way until August. That is a long postponement, if you ask me. The reason for his postponement is because Mickey D is dealing with health issues. He was hospitalized and now he's recovering. That's a long time to have to recover. All right, we also need to take a look at the international sports thread, and I'm just going to quickly go through this. And let's go back to page 1. And the problem here is Australia Open tennis. It's ongoing right now. There are several tennis players that are dealing with illness right now. We do know that flu cases in Australia are going up at this time. I'm going to continue to keep an eye on this. It doesn't need its own thread. The international thread is good enough for tracking that, but it is definitely a problem, and there's still a ways to go with the Australian Open. So it's something we're going to have to continue to watch. In Canada, the viral activity level for COVID-19 is moderate. Flu A is high. Flu B is high, and RSV. This is new from yesterday. I just refreshed this. Thought yesterday we had the update, but nope, this is the new update. Things have actually not gotten better yet in Canada. Nothing to take a look at the UK. We'll recap the UK again tomorrow. Let's take a look at what is going on with air qualities. If we can, this does not seem to be refreshing. Here we go. The West Coast is still dealing with problems in California, and there are some problems in the East, and I think we're going to continue to see more problems pop up in the East because there's some very cold weather coming in. We need to talk about that for a second. With the cold weather coming in, fireplaces are going to be used in the East, and I actually did a short little thread on X just a few moments ago, or about an hour ago, and I put extreme cold is expected for many, and even a moderate snowstorm for the Northeast. Yes, there's going to be a snowstorm in the Northeast tomorrow. This will keep many people indoors. Places like schools will likely cancel outside recess. That's if they even have schools. Places like Ohio and some of the Great Lakes areas, they very well may get canceled on Monday and Tuesday because it's going to be so extremely cold. But the point is, if they have school, it's going to be less recess. I mean, no fresh air. So they're going to be crammed in there longer. In general, people are going to be inside longer. And then you do have the problem in the southeast where it's going to be cold there, and there may even be some snow and ice. Increased number of accidents. And then in these cold areas, you have to be concerned about what could happen with frostbite and hypothermia. Put all this together, that could be yet again more strain on the hospitals, especially the emergency departments with the accidents in the southeast because of the icy conditions, which they're not equipped to handle. Then we also do have the problem that if more people are crammed inside, this could prolong or slow down the dropping of the respiratory illnesses. It could keep things going a bit longer. I mean, look up here in the upper Midwest and the Northern Plains. Yeah, extreme cold warnings. We're talking wind chills that will be 30, 40 degrees below zero. That is extremely dangerous if you go outside. You can get frostbite within a matter of 30 minutes, if not less, in that cold air. So please, if you have to go outside, dress in layers, wear a hat, wear gloves, make sure you do not have much exposed skin as possible. Hey, you know what? The mask actually comes in handy for this. You'll actually keep your face covered from this extremely dangerous cold air. All right, just thought I would bring that to your attention. Taking a live look at Pinellas County, Florida, we do see there are a few calls, falls, sick person, breathing problems ongoing there right now. And taking a look at Philadelphia yesterday, it was a busy day on Friday. 844 EMS incidents were reported. That is over 800. Anytime it's over 800, I do take note that that's considered a busy day in my book. Just my own personal ranking of how things are going. Montgomery County, Pennsylvania, we do see a few calls right now. There were up to and over 20 calls at one point earlier. Glad to see that has come down a little bit. In Chester County, Pennsylvania, not as busy as earlier, but respiratory difficulty is showing up a few times, heart problems, and a few other things are also showing up as well. Let's take a look at the hospital situation in Pennsylvania, and I'm happy to report it's not as bad as it has been. It still is bad, but you know what? It is a little bit better today. And I am noting there are still some hospitals here in yellow, but this one north of Norristown hasn't updated in weeks. I don't know what's going on there. We're seeing green in Westchester and Malvern. That's very good because those hospitals have been really busy lately. Keeping an eye on the Poconos this weekend. It's a big ski weekend. That could make more volume at the emergency departments. Taking a look at what is going on in New Jersey now, and we see, let's see, New Jersey has just two hospitals with problems today. That's very good. That means things are improving right now in New Jersey. We'll see if that holds going into next week. Taking a look at Walgreens here, and we can see the national positivity rate for Walgreens is 13.2% at this time. Taking a look at Los Angeles update for this week. The hospitalizations for COVID in Los Angeles are still rising at this time. 359. Deaths are not really going up just yet, and it does look like cases were starting to drop. There was a little bit of an increase on the most recent update, but it looks like they may have peaked at this time. They're not going straight down. They're just snaking their way down. Test positivity rate has continued to go up a little bit. It's 3.15%, and we do see here that wastewater looks like that may be starting to drop. We'll keep an eye on that. Emergency department visits was dropping, then it went up ever so slightly. Again, we will take a look more at wastewater tomorrow and several other things tomorrow as well that we have not been able to get to because there's just been so much news. But obviously, you know, if it turns into a busy news day tomorrow, well, that's where our focus will be once again. All right, we're going to end on this today with some data from CJS 83172. This was his Friday report. I did not include his Thursday report because we're simply starting to run out of time. I don't like to make these videos go over 20 minutes. Sometimes we do get over 25 minutes, and I don't like to do that, but we'll see where we go. Florida, daily number. This was 1,057 new cases and 36 new deaths, and 3,879 cases and 65 deaths reported over the past 7 days. With what was reported today and this week, Florida exceeded, get this, 99,000 total COVID deaths. That's ridiculous. They're one of the worst states right now. Around the country for this pandemic, they're one of the worst states. New Jersey, weekday number, 734 new cases and 5 new deaths reported yesterday, and 3,972 cases and 18 deaths reported for the week. New York, daily number, 1,424 new cases reported on Friday, and 8,341 cases reported over the past 7 days, along with 74 new deaths. Puerto Rico, daily number, 215 new cases reported yesterday, and 1,465 cases and 4 deaths were reported over the past 7 days. Alabama, weekly number, 216 CDC reported hospitalizations and 26 deaths reported by the CDC data tracker. California, weekly, 61 new deaths. Georgia, weekly, 246 CDC reported hospitalizations and 17 deaths reported by the CDC data tracker. Iowa, weekly, 156 CDC reported hospitalizations and 9 deaths reported by the CDC data tracker. Idaho, weekly 516 emergency department visits. That seems like a high number for them. And 4 deaths reported by the CDC data tracker. Again, that is 4, not 14. Illinois, 784 CDC reported hospitalizations and 37 deaths reported by the CDC data tracker. Kansas, weekly number, 152 CDC reported hospitalizations and 15 deaths reported by the CDC data tracker. Louisiana, 900 emergency department visits and 8 deaths reported. Missouri, 370 CDC hospitalizations and 30 deaths reported. You get the theme here. Deaths are rising. Mississippi, 12 deaths reported by the CDC data tracker. That's weekly. Montana, this is weekly. 257 cases and 1 death reported. Nebraska, 493 new positive tests and 6 deaths reported. New Hampshire, 15 new deaths reported over the past 3 to 4 weeks. That's a multi-week total. Pennsylvania, this is my state. This is just totally ridiculous. 1,429 CDC reported hospitalizations and 70 deaths by the CDC data tracker. So, 1,429 people got hospitalized in my state for COVID in the past week. Ridiculous. South Carolina, 174 CDC hospitalizations and 24 deaths. That's bad for South Carolina. Texas, 2,091 new cases and 21 deaths reported by the CDC data tracker. West Virginia, 3,543 new positive tests. Hey folks, I want to remind you something. 3,543 tests, that's a lot for West Virginia. That's in a day and age where a lot of people do this. Take these at-home tests. In fact, I think that may be more cases than the UK reported. That's pretty bad for West Virginia. So 3,543 new tests over the past 4 weeks. Okay, so that's the past 4 weeks. But you get the idea here. I don't care if that's even 4 weeks. That's really bad for West Virginia. It just shows that the viruses over the past several weeks have been really circulating. Mind you, that is a lag dump. 12 deaths reported by the CDC data tracker. That's over 4 weeks as well. But still, even if you divide that by 4, that just seems like a lot of cases for West Virginia, for a state that's not terribly big. The CDC reported, get this, 906 new deaths over the past week and currently shows 1,216,305 total U.S. COVID deaths since this all started, up from 1,215,399 it was showing last week at this time. And I also need to show you this. He put a note about my state, Pennsylvania. The 1,429 COVID hospitalizations in Pennsylvania reported by the CDC is nearly 10% of the nationally reported number of COVID hospitalizations. And I'm sorry this is getting chopped off by my camera. Let me zoom this out. The COVID hospitalizations reported by the CDC this week, which is 14,491. Still a high number, and that's just COVID. You got flu, you got RSV, you have Norovirus, you have pneumonia, you have all these different viruses which are causing hospitalizations. The hospitals are dealing with a tremendous strain at this time. In fact, I think tomorrow we're going to take a look at some hospital, either tomorrow or Monday. Mind you, Monday is a holiday. Monday might be a good day to do this. We're going to take a look at some hospital capacity data, if we can fit it in there. So if not tomorrow, expect to see that on Monday. Alrighty, folks, that does it for our very busy Saturday edition of the Virus Update. We'll have another Virus Update again tomorrow. If you enjoyed this video, give it a thumbs up, subscribe down below, hit that notification bell, and share this video with anyone you know. I will see you all again next time. Until I see you again next time, stay safe, everyone, and have a fantastic Saturday evening. Thanks for watching.